Okay, so I'm going to practice doing the medication administration for the oral and subcutaneous injection. I would first start by doing hand hygiene. I would verify the orders to the MAR. Um, I would make sure that um, everything is right with the order and the MAR put together. Um, then I would um, I'd make sure the patient does not have any allergies or if they may be allergic to that certain medication that we're giving them. So now at this time, I would um, get together my oral medication and my subcutaneous injection so I don't have to go back and forth. I would make sure that the order or the medication is right with the MAR, make sure it's the right drug, the right dose, the right route, and the right patient, given at the right time. Um, Once I got that together, I make sure that the calculations are correct with each of the meds and verify that with another nurse. Once I got all that together, I would recheck again with the MAR that the medications are correct with the right drug, right dose, right route, and right time to give to the patient. Um, so then I go to the patient. I'll provide privacy. I'll do my hand hygiene, um, identify the patient with date of birth and name. I would verify the orders again, let the patient know what medications we're giving them, if they have any questions, educate them on adverse reactions and everything. Um, so once I'm by the bedside, I would then check again for that medication is right with the orders, the right patient, right drug, right dose, right time, and right route. I would get the site ready for injection. You want to go dirtiest to or cleanest to dirtiest. So I would clean the site, inspect it for any inflammation, redness, all of that. Um, so then I would clean the site. I would grab the tissue, subcutaneous tissue, uncap the needle, stick it at a 90-degree angle if it's has a lot of subcutaneous tissue. Then I would secure the syringe, and then I would inject the medication slowly. Then I would remove it, use a cotton swab, and hold it on the patient, the site, put the safety up on the needle, and then throw away my needle, and put a band or check the site for any redness, inflammation, bleeding. Then I would cover the site up. I would throw everything away, wash my hands, and then I would move on to the oral medication. I would remove my gloves. Then I would get ready for administering the oral medication by rewashing my hands, um, give the medication to the patient in a medicine cup, make sure that they can swallow, um, and tell them they need to, and give them a drink, make sure that they swallow it, check their mouth, and you have to stay in there with them. And then after that, you can throw all the supplies away and make sure afterwards I document the patient, um, the drug given, the dose, route, how they tolerated it, the time, and that is all.